I am honored to be with one of the leading people in startup dental practices in terms of consulting. This company's name is Ideal Practices. I'm with the president of the company, Stephen Trutter. They, like I said, are one of the leading consulting companies for startup dental practices. And it's cool because they can help all the way from finding demographics in a particular city that you're thinking about maybe opening a practice, to the legal stuff, the equipment, the real estate, the financing, the office design, pretty much everything. And Stephen, thank you so much for being with us. I'll let you talk a little bit more about it in a second, but I appreciate you joining us today.
Chris, great to be here. Thanks for having me here, and can't wait to share some insights here with the industry and with the community. So thanks a lot. Really appreciate your support.
Awesome. Love the skis behind you. You gotta tell me more about those.
Oh man, some birthday or Father's Day a few years ago, and you're in Colorado, but I'm in Florida, and we don't have a lot of mountains in Florida. But I'm an avid skier, and I go out there a couple times a year. And my wife said, I'm going to get a pair of vintage skis. So she actually contacted her brother-in-law, I call him my brother-in-law, lives in Denver, and found these. My wife found these at like a local thrift shop. I mean, these things are in great shape. I was showing you earlier, like the leathers and everything here. So whenever we moved here about a year and a half ago, they've always been in an office. They've always hung on the wall. And so, yeah, I don't know, 50s or 60s. I will not take them off and ski in them in the winter though. So I will not. So.
Yeah, it's crazy that people actually used to strap those things on. I mean, I can't even imagine.
No wonder why people broke ankles back then. So there we go. That's a broken ankle right there.
Yeah, absolutely. All right. So why don't you start off just telling us a little bit more about Ideal Practices, what you guys do, a little bit about yourself, and we'll go from there.
Chris, thanks. Yeah, you know what? We have the fortunate opportunity to be able to serve the dental community and being a leading consulting firm for dental startups. That's who we serve, private practice ownership. So our goal is always simply to be able to empower young dentists today to be able to open up their own practice through the means of a startup. We don't support corporate dentistry, or I don't set up corporate dental offices. So it's really fueling private practice ownership and giving young doctors today, especially the opportunity of clarity and confidence on how to open up a practice properly with a customized step-by-step process. So my partner, many people may know, Jamie Amos. You probably see him all over the media. We lead a team of 15 individuals and really 15 experts to be able to guide clients with expertise in certain areas, just like you as dentists are all experts or specialists. We have specialists that are able to guide through areas of financing, real estate, demographics, systems, hiring, protocol, floor planning, negotiations of equipment and construction. So there's not an area that we don't touch. And we built some of the greatest success stories in the entire country. And everybody's got a different idea of what success is to them. And so the joy that we get is to be able to build a practice that can not only just open, but open with purpose. And so our practice owners open with a purpose to be community leaders. So it's a thorough joy of doing it over 15 years and almost 700 startups myself to be able to say, wow, we get to do this every single day, and every single practice is different.
Yeah, I think that's awesome. And as you know, I mean, it seems like even this year, even through COVID, we've gotten here at KickStart so many calls from new dentists just looking to start up a practice. And, you know, we certainly can help them on the marketing side of things, but there's so many questions that they have about, you know, opening a practice. Where should I open? And, you know, what kind of design, you know, should I build? And there's just so many questions other than marketing that I see so many people needing. And these are crucial topics that, you know, if you get wrong in the beginning, it can really, you know, set the tone for your practice for years to come. So you got to make sure that you get a lot of that stuff right.
100%.
Yeah. So tell me, how did you guys get started in this? How long have you been doing this, and how did it all come about?
Oh, wow. 15 years of doing this. My partner and I each have been 15 years. And I think what happened was we realized a number of years ago that there was the typical path of starting a practice years ago was trial and error. And many of you watching this are probably going, oh yeah, I had a friend that did that. And then they struggled for 3 or 4 years and they continued to work as an associate 3 years into their startup. And And we were like, there's a better method. And part of that better method wasn't just like, how do we get bigger revenues? It was more of like, what we would call like these 3 tiers. If you can imagine like a stair step, we say like, great, everybody can open up a practice. We call it the 3 Ps. We call it practice, profits, and then purpose. And everyone can get there to practice. And we realized like, well, everybody can get a practice. 4 walls, throw a roof up, and got some chairs, and you've got a practice. That next tier, few people realized it was like the profit side. And that's where you start to develop like systems and protocol to be an actual profitable dentist. And many can achieve that. The different tier was this layer, what we would call purpose. That's that ultimate layer. And we realized that no one really strived toward having a practice with purpose. They kind of were like, I know I don't want to work for somebody else. I know I want to like be profitable, but how do I have a practice that can serve my community in a bigger cause? That way people are choosing my practice, not because of my discounts, or people don't work for me because of I pay the most. It was like, wow, we can now build a practice for purpose. And nobody had a program, and no one had built something. Everyone was just kind of like getting bits and pieces from areas. So we said, let's build a program. Let's build a step-by-step process that can be a guide to be able to get practices open successfully. Because that's the key, is successful opening, not just opening, because everybody can do that.
Exactly. Yeah. I see dentists sometimes they're in a huge rush to get open. And I understand that there's financial responsibilities. There's, you want to get to market, but, part of me sometimes wants to tell them, hey, slow down, take a breath, make sure we get this right from the beginning,
Yep.
Build that foundation and go. So I think that's
the margin of error, even pre-COVID, where we're at now, and the margin of error pre-COVID was small in terms of startups. The margin of error is smaller now. So like to be able to have a process to get open successfully, find the right location, negotiate the right things, it is crucial to getting open properly, and to be able to have a platform so that you can have predictability for a decade or and beyond. That's the key.
Yeah, and this is a good segue. What are some of the most common things that you see new dentists miss the boat on when they don't, maybe obviously a lot of them are younger people that are just starting their first practice. Yep. What are they missing the boat on? Where's some common mistakes that you see?
I think one of the biggest areas that I see right now in the digital age and technology age and the information age is, I call it kind of the peanut gallery effect. And you may be familiar, everyone's heard the term, the peanut gallery. And the peanut gallery really is like the unsolicited advice. And even I see young dentists that come to us and approach us and they say, yeah, as soon as someone says, I want to buy a practice or I want to open up a practice, all these people, or all they do is tap on their computer and it's like all these people have these opinions. And a lot of the opinions that are out there are well-intentioned, but they come from people that either have only done it once, twice, or maybe never at all. And so they take this piecemealed approach to taking advice from people that may be testing their theory because they're not willing to take the leap and to start into private practice ownership.
Yeah.
And then they end up with like, wow, I could have opened on a timeline, but I ended up waiting 3 years because I took this advice from this person, or it's very, very biased. So I would say watch where the information comes from, because one of the biggest pitfalls is going by advice that isn't proven advice in startups. Practice management is different for startups than for established doctors. So even doctors are like who maybe been open for years has well-intentioned advice for young doctors. The challenge is their advice is coming from a practice that may be very tenured and very seasoned, and that doesn't apply to startups. Startups are a totally different animal. So I'd say that's one of the biggest common tips that or kind of mistakes that I see. I think the other areas are real estate, and really chasing down real estate and thinking that I need real estate and funding, which is very, very important, but just kind of going down that path of saying, let me just go find a space, and not realizing like what is the opportunity here from a demographical perspective, and really doing the internal research of seeing who do I love to serve on a daily basis, and being able to find that abundance of the kinds of people that are there. And I think the third mistake I see a lot is in your world, Chris. I see this, you see it on Facebook posts. It is like it is haunting sometimes. The post that comes from the doctor goes, hey, I'm getting ready to open my practice in 4 weeks. What's everybody doing for marketing? A marketing strategy has to develop months in advance. And it's kind of like the forgotten thing of, oh yeah, and I need these things called patience.
Right.
Patience, there isn't a silver bullet for marketing. There isn't, and you know this. It needs to be a developed strategy that takes months to implement and deploy, and they got to have resources like what your team provides and like what our team helps develop for our clients outside of like even what you do as an agency to be in their community, knowing that it takes a ton of hard work to market a practice, and it can't just be like, what's the quick trick that everybody did a month before you open? You're late. You're too late. You're not gonna launch.
Yeah, no, I totally agree. And it's, it used to be kind of a, if you build it, they'll come, but that's changed now because there's so much pressure and there's so much competition in even the smallest markets now that that's not so much the case. You've got to have a plan. You got to have a strategy in the marketing side of it for sure.
100%.
Yeah. You talked a little bit about the real estate side of it. And that was one of my next questions is, in real estate, at least, the old saying is kind of location, location, location. And, I'm guessing that that's pretty true when it comes to dental practices as well. I'm asked sometimes, is it worth the extra, X $1,000s of months of lease or extra thousands of dollars to build a practice to be in the right location? I know personally from marketing, we have several clients that have what you would consider kind of tier 1 type locations. And we track everything from marketing for our clients. And we find that those people that are in those grade A or number 1, tier 1 locations, they do see sometimes a significant amount of traffic just from people seeing their sign along a road or they work near them, a populated area, something like that. So maybe you could tell us a little bit more about this location thing. How important is it, and should somebody spend more money for that?
I think it depends on a number of different factors. There's always the balancing act between like, is the juice going to equal the squeeze in terms of like that real estate? In many cases, you can be a block off the main road of everything and save yourself 30 to 50% in real estate savings. That's true. Mm-hmm. And I would say I've had a number of huge success stories. We have $1 million practice owners in 12 months, and I can think of multiple doctors. And I can think of one like Dr. Alexis, who opened up a practice. She wasn't on the busiest street. She didn't even have a sign, and she was 2 doors down from another provider. And in 12 months, created $1 million practice. And it wasn't just simply her location. So while location, I think, can play a role, I look at it and say, it is not the number 1 criteria for success of a practice. So when people say, I have the biggest sign, well, that's great, but it works well for like Starbucks or McDonald's to be on that corner because, well, people are going to get their $8 coffee and their $1 cheeseburger.
Right.
But in 15 years and almost 700 startups, I've yet to have a practice as a drive-through hygiene room.
That's a good idea, though.
Maybe I'm gonna pioneer something here, but the location is important. But you got to balance it with like your available funding, who you're trying to attract from a patient base. Right. In some cases, you may get that great location, spend 30 to 50% more in expenses and overhead, and the patients that may come through may not be your ideal patient as well. So I don't say location is important, but it has a lot less to do with pretty buildings and big signs.
Yeah. Okay. That makes sense. Well, why don't you tell us a little bit about, if there's a new dentist out there that's looking to start a practice and they want to work with you potentially, when somebody hires you, what's your process? How does that start?
Part of it is it starts with a consultation, and we have a limited amount of consultations each month. So, that's one thing I'd like to say is one thing I'll be able to offer like our viewers today. And for those that are like more interested in like, hey, I'm just not quite sure, like they can even check out our podcast, the Ideal Practices podcast. or the Startup Dentist podcast that has a ton of resources where basically we take our 13-stage process and we're actually doing it in bite-sized podcasts through the Startup Dentist podcast. So that'd be a great way for people to be able to figure out, like, is this the right path in terms of startups? But we really go through a process with clients to be able to understand what their true vision is of a practice. And so it starts with a consultation with our team to be able to understand, like, is this a good alignment for both parties to be able to do that? And then it's everything that we do is customized. This is a 12 to 18 month process. And so it starts off with a very rigorous vision call where we go through, like, really almost like setting the stage for the next decade and beyond. And it's not just based upon, like, what kind of chairs do you want and what your colors are going to be. It's like true vision of what a client wants to capture in their community. And so that 12 to 18 month process will go through everything from funding analysis to demographical marketing strategies, hiring, and some of the scariest things about the business systems, floor planning and negotiations, effective negotiations with vendors, and on everything from real estate to equipment and construction. So our process is a 12 to 18 month process. Some people are shorter, some people are longer, but everything that we do is customized to the individual client because I don't have a book that says follow, or a manual that says follow this manual. Yeah. It's individually strategizing with each client on each individual phase so that when they open, they are prepared. My goal is twofold: to be able to have a client to be able to get out of working for somebody else as quickly as possible. And number two is when that first patient comes in, I want that first patient for each one of my clients to be able to say, wow, I'm your first patient. This is the most well-oiled machine I've ever seen of a practice on their very first patient that they see. That's it.
Yeah, that's awesome. Now, what about a practice or somebody that buys an existing practice? Can you help with that or no?
We've really dedicated ourselves to startups. That's a totally different animal of, like, acquiring a practice. And I don't discourage acquisitions. It's the right fit for the right people. And startups are not for everybody. So I would say there's probably a lot of great resources out there to acquire a practice, but my systems are built for startups because acquiring practice is really looking at systems differently and really trying to adapt systems versus my team is really, the line I give a lot is, we're really good at developing and preventing. We're really not as great at, like, fixing. In other words, it's hard to fix something if it's kind of broken in a practice. It's a lot easier to say, we got a foundation to build upon.
Yeah. I know on our side of the marketing stuff, we obviously work with existing and new, but the new ones are kind of nice because nobody's gone in and really messed anything up. So it's kind of like, you can build something from the ground up and, you can kind of start from scratch. So it's
it. It's like a golf swing. It's like I can have bad habits for 10 or 15 years and then take lessons, and then someone's trying to fix me. If everyone saw, like, the old videos of, like, Charles Barkley, like, years ago, when he was, like, trying to get his head, like, he had hitches and everything in his golf swing. And it's like, if he had just taken lessons like 20 years ago when he was still playing in the NBA, he would have had, like, a pretty grooved swing.
That's right.
My analogy is I'd much rather be able to take somebody who goes, I don't know how to run a practice, and develop strategies that are built and it can be tiered up and really scaled.
Yeah, no, absolutely. Well, I guess finally, if somebody does want to work with you, and I appreciate, I know you only have so limited time and limited free consultations that you guys can do. So offering our viewers one of those is awesome. I really appreciate it.
Absolutely.
If somebody wants to take advantage of that, what's the best way to go about it?
Best way to go about it is check out our website at idealpractices.com. And we have, and then I'll make sure that Jen, who's one of our, everybody who talks to Jen, you will all love Jen. Jen's one of our strategy advisors. I'll offer and I'll let Jen know, like, we're going to have, be able to offer private consultations to any of the viewers that come from this opportunity. Typically it's like a 1 hour consultation. And in those consultations, what you'll find with Jen is you'll understand the care that our team really wants to provide for these doctors and for you as viewers to understand, like, what are your goals and how do you want to accomplish these? So for everybody that I want to be able to offer something today is that consultation.
Awesome. Well, thanks so much. I appreciate you taking the time to do this. I know you're busy. I know that this is going to add a lot of value to folks that come to our website and look for, help with starting up a practice, because there's so much to do and so much stress. It sounds like I know for a fact from working with you that you can really just take a lot of that stress and leverage that with your experience of doing, how many, did you say 700 startups?
I'm approaching, it was, I remember Jamie was talking, we did the numbers somewhere between 650 and 700. So not one is the same. They're all very, very different, different states, everything. So,
That's awesome though.
Yeah,
For somebody to be able to just leverage that experience and, what works well, what doesn't, I mean, that can go a long way. So thank you so much for your time. And hopefully we can bring you back and do another segment.
I'd love to. Thanks, Chris. Thanks, everybody. Be safe.
Talk to you soon.
Bye-bye.